Why do nearly 700,000 Americans still lose their lives every year to cardiovascular complications, even though they take their blood pressure medication faithfully and consistently? Face this brutal reality. According to the American Heart Association, up to 122 million adults are struggling with hypertension, and while 75% of them are on medication, those pills are not controlling the root of the disease. We are witnessing a silent crisis where medication is merely a veil covering the internal decay of the vascular system. I am Dr. Mattheus, and after more than 20 years of performing major cardiac surgeries, I stand here to tell you a harsh truth. What you have been told about high blood pressure all this time is fundamentally misleading and incomplete. You have been taught that this is just a simple plumbing issue, that there is too much fluid in your circulatory system. Your doctor asks you to cut back on salt, take a diuretic to flush out water, and when the numbers on the monitor drop, you think you are safe. But in reality, that is just a medical illusion. It is not that simple. That entire framework is half a century out of date. It leaves millions of people on the brink of danger, even when their blood pressure readings look good. Hypertension is not a story about fluid volume. It is a story about the pipes themselves. Your arteries are not just overfilled, they are being ravaged, stiffened, and drained of life at the cellular level, something no current prescription medication can reverse. When I perform bypass surgery and open a patient's chest, I see this destruction with my own eyes. A healthy artery has incredible elasticity. It springs back with vitality under the surgeon's scalpel. But with a patient like Mr. Richard, who has suffered from chronic hypertension for 15 years, incising his artery feels like I am cutting into bone. It is rigid, calcified, and lifeless. This stiffness is the true essence of the disease, and medication is only manipulating the numbers while ignoring the structural damage progressing silently. Stay with me until the very end, because by the conclusion of this lecture, you will discover a medical secret about the miraculous self-healing ability of your vessels, a surprising revelation that very few clinical physicians ever disclose to you. You will understand the 4 deep-seated hidden mechanisms that create hypertension and master the complete 4-step protocol to actually repair this damage from the cellular roots. This is the fusion of modern biology and the philosophy of preserving life. Mechanism 1. Glycocalyx destruction and endothelial damage. Let's look through the true nature of hypertension at the most microscopic level. Your arterial system is not just a set of hollow pipes but vibrant living structures with 3 distinct protective layers. The innermost cell layer, which stays in direct contact with every blood cell, is known as the endothelium. Imagine it as a membrane thinner than tissue paper, yet it lines the entire vital transportation network of your body. The role of this endothelial layer is absolutely essential. It doesn't just separate the blood flow, but acts as an executive center producing signals to control circulation, prevent abnormal clotting, and keep your vessels youthful and healthy. Coating this endothelial layer is a microscopic shield we call the Glycocalyx. Think of it as a magnificent non-stick cushion lining the interior of your arteries. This structure is woven from sugar molecules and proteins only a few micrometers thick, completely hidden from the naked eye, yet it is the foundation of the cardiovascular system. According to reputable medical reports, this shield performs life or death duties. First, it creates a perfectly smooth surface for blood to flow without any resistance. Second, it prevents inflammatory triggers from latching onto the vessel walls. Third, it acts as a sensitive sensor, recognizing changes in blood flow to stimulate the release of nitric oxide, a gas that keeps vessels relaxed and flexibly dilated. When this shield remains strong, your vessels maintain their inherent resilience. However, when destruction occurs, the entire foundation collapses. Prolonged high blood sugar, chronic inflammation, and unhealthy lifestyle habits erode this protective layer like acid destroying a coating. Once the shield is stripped away, your vessel walls become dangerously exposed. Harmful factors and cholesterol invade the vascular tissue, starting the formation of hardened plaques. At this point, the production of vessel-relaxing gas stalls, causing arteries to constrict and lose flexibility, leading to a spike in blood pressure. This is the root of the devastation, the collapse of the shield and profound endothelial damage. Have you checked your blood sugar recently? If you're monitoring it daily, please comment number 1 for me below. You must understand a key reality. No standard blood pressure medication can rebuild this shield. Current pharmaceutical drugs only help you manipulate the numbers shown on your home monitor, while the core damage inside continues to progress. Therefore, even if your blood pressure readings look stable thanks to pills, your vessels may still be silently deteriorating and heading toward dangerous events. Medications are only helping you trim the tip of the symptoms without ever touching the root cause of vascular collapse. Mechanism 2. Arterial stiffness and calcification. This brings us to a core issue, the hardening and calcification of your blood vessels. In modern medicine, many doctors accidentally overlook this crucial detail. They are so focused on bringing blood pressure numbers to theoretical levels that they forget to check whether your vessels are flexible or as hard as stone. In reality, the elasticity of your arteries reflects your health destiny far more accurately than mere numbers. Reputable studies since 2010 have confirmed that arterial stiffness is a better predictor of cardiac events and longevity than traditional blood pressure measurements alone. You usually see blood pressure displayed as two numbers, the top and the bottom. The difference between them is the pulse pressure, a golden indicator that reveals the resilience of your arteries. In an ideal state, this number should stay between 40 and 50. However, as time and disease take their toll, the top pressure often spikes while the bottom pressure drops. Imagine having a reading of a 162/72. Your pulse pressure would be 90. Once this number exceeds 65, it is a warning that your arteries, including the aorta, have become calcified and lost their ability to stretch and cushion the heart. Leading cardiologists since 2006 have introduced the pulse wave velocity test to directly measure the aging of your vessels. This test monitors how fast blood waves travel through your system. With a youthful set of vessels, blood waves glide leisurely, at about 20 to 23 feet per second. But in hardened vessels, the waves race through very fast, reaching 40 to 50 feet per second. The faster the wave, the stiffer the vessel, and the higher the risk to your heart. Although this is a simple and painless test, it is rarely performed in routine checkups because current drugs cannot directly soften sclerotic arteries. Traditional pharmaceutical methods only try to control the surface symptoms while ignoring the deep structural damage within. To help you visualize this, look at the structure of the vessel wall. It has a middle muscle layer that allows the artery to contract flexibly. But over the years, especially under the impact of inflammation and high blood sugar, this muscle layer begins to suffer destruction. First, calcium crystals that should only stay in your bones start to invade and deposit here, making the vessel walls rigid. Second, elastic fibers break down and are replaced by stiff fibers, causing the vessel to lose all resilience. Third, smooth muscle cells transform and begin to behave as if they are creating bone right inside your vessels. Have you checked your pulse pressure lately? If your top and bottom numbers are very far apart, comment 2 below. Scientific reports from 2019 have confirmed that this calcification process is the leading cause of making seniors' vessels as rigid as bone tissue. At age 65, without proper protection, your arteries may no longer be soft tubes, but have become dry calcium pipes. Standard blood pressure medications are completely powerless to reverse this process. They might help muscles relax temporarily, but they cannot strip away the calcium already embedded in the structural walls. So the big question is, can you regain the softness of your vessels? The answer is absolutely yes, but not through medication, but through deep nutritional secrets that I will share with you right now. Mechanism 3. Nitric oxide deficiency. The third crucial point I want you to understand deeply is the decline of nitric oxide. Imagine nitric oxide as a natural relaxation gas produced by the cells lining the inside of your blood vessels. Prestigious cardiovascular studies from 2012 have confirmed this is one of the most vital communication messengers in your circulatory system. When this gas molecule is released, it permeates the muscle layer of the vessel wall and commands these muscle cells to loosen up. As a result, your blood vessels dilate, blood flows more smoothly, resistance drops, and blood pressure automatically cools down. A youthful vascular system produces this gas continuously to keep you in a state of balance and safety. However, tragedy strikes when the inner protective lining is ravaged, when the non-stick cushion I mentioned earlier is eroded, the capacity to manufacture nitric oxide collapses. At this point, your vessels lose their ability to relax naturally. They remain in a state of stress and constriction. Consequently, blood pressure rises and freezes at dangerous levels. Behind this production process is a biological tool called the eNOS enzyme. This tool is easily damaged by factors like high blood sugar or prolonged inflammation. To function smoothly, eNOS requires a powerful assistant called BH4. When the body has enough of this assistant, relaxation gas is produced abundantly. But when BH4 is depleted, the eNOS tool malfunctions, creating harmful free radicals instead of beneficial gas, directly attacking your blood vessels. An interesting secret is that this gas production tool can be activated by the physical pressure of the blood flow itself. When you move and blood flows faster, the friction against the vessel walls awakens the eNOS enzyme to work vigorously. This is the core reason why exercise is the most natural blood pressure medication. Medical analyses from 2014 have shown that isometric exercises contracting muscles without moving yield incredibly surprising results. A simple method is using a hand grip device, squeezing it at a moderate level, about 30% of your strength, and holding for 2 minutes, then resting for 1 minute and repeating for 4 rounds. This method has been clinically proven to lower systolic blood pressure by 8 to 12 points after just 2 months of consistent practice, a result that sometimes even pharmaceutical drugs struggle to achieve sustainably. Mechanism 4. The insulin-kidney connection. Now we shall analyze the final and crucial link, the interaction between insulin and your kidneys. This explains why cutting out salt often proves futile for many struggling with hypertension. The kidneys act like a steward regulating sodium to maintain stable blood pressure, but this steward's ability is entirely dictated by another hormone. Here is the alarming truth. High insulin levels command the kidneys to retain salt instead of excreting it. When your body has chronic excess insulin, your kidneys are locked in a sodium hoarding state, regardless of how strictly you follow a low-sodium diet. Leading medical research since 1987 in the New England Journal of Medicine confirmed that insulin resistance is the driving force behind escalating blood pressure. Insulin impacts the filtration system through 3 primary pathways. First, it directly promotes salt reabsorption within the small kidney tubes, forcing sodium back into your bloodstream instead of out through urine. Second, insulin triggers the sympathetic nervous system, stimulating the kidneys to produce hormones that constrict vessels and continue to retain salt while flushing out potassium. Third, it makes your blood vessels extremely sensitive to constricting agents. Reports in 1991 also affirmed that insulin resistance is a multifaceted syndrome, causing not just hypertension, but also obesity and severe vascular conditions. This explains why individuals with prediabetes or type 2 diabetes almost inevitably face hypertension. Excessive insulin is imprisoning their kidneys in a continuous sodium retention mode. There is a point many of you miss. You can have severe insulin resistance even without having diabetes. Your fasting blood sugar or a 1C might look perfectly normal, yet your blood insulin levels could be silently skyrocketing and damaging your vessels daily. Most doctors today only check glucose while ignoring insulin levels, leading to the false conclusion that everything is fine. And if you are still following along, I would like to invite you to leave the number 9 in the comments. That will be the way for me to know you have received good knowledge and found it helpful. They are mistaken, and that misunderstanding prevents your condition from being treated at the root. However, identifying the enemy is only half the battle. To truly regain control over your health, we need a specific reconstruction strategy. Therefore, I invite you to join me in the first phase of our action plan, where we will begin healing the deepest damages by focusing on restoring the protective glycocalyx layer for your vessels. Step 1 of the reversal protocol, glycocalyx restoration. Now let me guide you through a complete 4-stage roadmap to thoroughly reverse these vascular damages. The pivotal starting point is regenerating the glycocalyx cushion. Your top priority is to cease all actions that harm it. The most dangerous invaders are skyrocketing blood sugar levels and oxidative stress. You must know that every time your blood glucose exceeds 145 milligrams DL, it triggers a chemical attack that melts away this protective cushion. Therefore, the first objective is to keep your blood sugar in a state of calm stability, specifically ensuring post-meal numbers never surpass 140 milligrams DL. This means you need to initiate a dietary revolution by strictly minimizing processed starches. Do not worry about eliminating all carbohydrates. Instead, wisely choose foods that do not cause blood sugar shocks, such as whole grains, fresh leafy greens, legumes, and low-sugar fruits. Be resolute in saying no to refined sugar, white bread, white rice, or pasta. The second task is to provide your body with high-quality bricks to rebuild this cushion. The structure of the vascular protective lining is woven from complex molecular chains. The most exquisite nutrients for reconstructing them lie deep beneath the ocean, specifically the compound fucoidan found in brown seaweed. Medical data in the US has confirmed that these nutrients have a miraculous ability to restore the thickness of the endothelial lining. You can find supplements containing fucoidan with recommended doses ranging from 600 to 1,000 milligrams daily to support this healing process. The third task is to extinguish the fires of oxidative stress that are silently ravaging your body. Your strongest allies now are the natural antioxidants from vibrantly colored vegetables and fruits, like berries, kale, beets, or even dark chocolate and green tea. These foods contain active compounds that help neutralize free radicals before they can reach and damage your vascular lining. Consider the story of Mr. William, a 71-year-old patient who lived with hypertension for 13 years and relied on 2 medications daily. Although his blood pressure was at 130/80 seconds, his vessels were starting to show signs of exhaustion. He began this protocol by eliminating white starches, supplementing with 800 milligrams of fucoidan, and adding plenty of greens and berries to his daily diet. After just 12 weeks, his vascular dilation capacity doubled. His blood pressure dropped to an ideal 116/74, allowing him to cut 1 medication, and after 6 months, he was completely medication-free with stable readings at 120/76. Step 2. Decalcification and restoring flexibility. Now we move to the second stage, liberating the vessel walls from calcium invasion and reclaiming their original suppleness. Most people hold a fatalistic belief that once blood vessels are calcified, it is an irreversible sentence. However, I am here to tell you that such belief is outdated. The key lies in a smart protein called matrix GLA protein, MGP. Imagine this protein as a dedicated traffic officer whose duty is to direct calcium along the correct route into the bones to build the body's frame, instead of wandering into the arterial walls. When this officer is neglected, calcium floods the arteries, clings to the walls, and causes rigidity. To activate this officer, we need an essential nutrient called vitamin K2, specifically the MK7 form. Reputable scientific reports in the US have proven that incorporating these active compounds through diet and supplementation is closely linked to minimizing coronary calcification. Long-term studies in Europe also confirm that the presence of this nutrient significantly reduces cardiovascular risks. Without enough vitamin K2, the MGP officer stays asleep, allowing calcium to deposit freely and harden your vessels. But with adequate nutrients, calcium is redirected out of the arteries to fortify the bones. You can reverse this situation by maintaining a daily dose of 180 to 360 micrograms of MK7. However, vitamin K2 cannot fight alone. For calcium to truly be absorbed and integrated into bone tissue, it needs the support of vitamin D. This vitamin enhances calcium uptake from the digestive system, creating perfect synergy. Additionally, an indispensable component is magnesium. I often call magnesium nature's softening agent. When your body is sufficient in magnesium, it prevents calcium from entering smooth muscle cells illegally, keeping vessels from constricting and blood pressure from spiking. Magnesium also helps keep calcium in a dissolved state, preventing it from crystallizing into dry plaques. Unfortunately, most of you today are deficient in magnesium due to diets low in leafy greens and nuts, plus psychological stress and chronic medication use. To restore this flexibility, you need to supplement with highly absorbable forms like magnesium glycinate at a dosage of 400 to 600 milligrams daily. Consider the case of Mr. Michael, a 74-year-old patient who battled hypertension for 18 years and relied on 4 different medications. Despite the heavy medication, his blood pressure often lingered at an alarming 136/86, and scans showed severe calcification throughout his aorta. He began his healing journey by supplementing with 360 micrograms of vitamin K2, 6,000 IU of vitamin D, and 600 milligrams of magnesium glycinate daily. The results were astounding. After 6 months, calcification decreased by 9%, blood pressure dropped to 122/78, allowing him to cut one medication. After 18 months of persistence, he only required a single medication with very stable health. Step 3 and Step 4. Restoring nitric oxide and resetting insulin. Moving to the third stage, we will focus on reawakening the flow of nitric oxide. The first move in this journey is to protect and fortify BH4, a powerful assistant that ensures the production engine of vascular relaxation gas runs smoothly. Ensure your body is fully loaded with nutrients like folate, vitamin C, and vitamin E. These active compounds act as repairmen, helping to regenerate BH4 and prevent endothelial system dysfunction. Seek out folate in dark leafy greens, vitamin C from vibrant berries or citrus fruits, and vitamin E from nutty seeds. Medical reports since 1999 have confirmed that oral vitamin C supplementation can soften hardened arteries in humans. The next task is to activate the natural mechanism through physical force. I recommend performing isometric hand grip exercises. Use a simple hand grip device. Maintain 30% of your maximum strength for about 2 minutes, then rest for 1 minute and repeat for 4 cycles. By doing this just 4 times a week, you are directly commanding your blood vessels to dilate. Finally, a very simple secret is to practice nasal breathing. Our nasal passages are miraculous nitric oxide factories, and breathing correctly can boost the concentration of this gas molecule in your bloodstream by up to 400% compared to mouth breathing. Now we step into the fourth stage, resetting insulin balance. This is the key to unlocking your kidneys, allowing them to fulfill their natural duty of excreting excess sodium. Once blood insulin levels are too high, they imprison the kidneys in a sodium hoarding mode. To resolve this, the most refined method I often teach my patients in the US is time-restricted eating. You should compress your food intake into a specific window and allow the body to rest during the remaining hours. The ideal protocol for seniors with hypertension is fasting for 16 hours with an 8-hour eating window. You can have your meals from noon until 8 p.m., and then only drink water or plain tea until noon the next day. Real-world data shows that this method helps lower systolic blood pressure by 9 to 11 points in just 8 weeks, even before you change what you eat. The secret lies here. When insulin drops, the kidneys are liberated, sodium is excreted, and blood pressure naturally finds its way back to normal. Additionally, to eliminate insulin resistance at the cellular root, incorporate gentle resistance training such as light weights or resistance bands about 2 to 3 times a week. This makes your cells more sensitive, reducing fasting insulin levels by 20 to 30% within just 3 months. Closing remarks and guidance from Dr. Mattheus. This is what truly reversing hypertension looks like. It is not about managing temporary symptoms with pills, but about repairing the underlying mechanisms permanently, restoring the glycocalyx, decalcifying the arteries, producing nitric oxide, and normalizing insulin. These 4 pillars address the actual root causes of high blood pressure. When you address the root causes, blood pressure will normalize naturally. Our bodies are designed to heal themselves when provided with the right conditions. Start with just 1 step. If you consume refined carbs, start by stabilizing your blood sugar to save your vascular lining. If you are overweight, begin resetting your insulin through time-restricted eating. And if you rarely exercise, start restoring your nitric oxide through simple isometric training. I must urge you, never stop your medication abruptly, as it is extremely dangerous. Initially, medication acts as a shield, while these natural protocols work silently to fix internal damage. You need both in the beginning. Implement these changes while continuing your current prescription. As your health improves over the months, work with your physician to gradually reduce medication under supervision. Monitor your blood pressure daily at home and track positive trends. Once your numbers are consistently stable, discuss medication reduction with your doctor. Never act recklessly or change dosages without medical guidance. Do not accept the belief that you will need medication for life. Conventional medicine often focuses so much on manipulating pressure readings that it forgets how to restore actual vascular damage. But you now have a different perspective. You understand the protective cushion, calcification, relaxation gas, and the insulin-kidney connection. Once you understand the mechanisms, you have the power to correct them. This is the boundary between management and reversal. Management means lifelong dependency on pills, while reversal means structural repair at the cellular level. The faulty mechanisms we discussed are the culprits, and standard care often overlooks them. You have the ability to repair that damage, restore the protective layer with blood sugar control and marine nutrients, decalcify with vitamin K2, D, and magnesium, reawaken your vessels with proper breathing and movement, reset insulin by adjusting your eating window. When these mechanisms are healed, blood pressure drops not because it is forced down by chemicals, but because your vascular system has regained its original resilience. This knowledge is the key to freeing yourself from medication and avoiding tragic cardiovascular statistics. Take action today and subscribe to this Dr. Mattheus channel. I am committed to sharing insights to help you keep your vessels healthy and away from my operating table. Cherish your blood vessels, they are the only ones you have. Hypertension is not a permanent sentence, it is reversible if you are willing to do the work. The choice is yours. Choose reversal or choose management. Thank you for listening.